Welcome back to TV5 News at 9. With rising mental health challenges and the growing influence of social media, today's youth are facing pressures unlike any generation before them. CMU Health's behavioral medicine team is on the front lines, though, helping young people and their families navigate this complex emotional landscape. So joining us this morning are child and adolescent psychiatrists from CMU Health, Abhishek Bala and Nikita Roy. Thank you both for being here.
Thank you for having us.
So just before we get started, tell us a little bit about your roles, what you guys do, and how this differs from adult psychiatry.
So we are both child psychiatrists. We are working at HealthSource on an inpatient unit. And I think what separates child psychiatry from adult psychiatry is really treating not just the individual, but families and the environment. Kids are not in isolation. They are really involved in their environments, their school systems, and their families. So we really have to understand all of those pieces of the puzzle and not just the individual. And so we collaborate with families, with social services, with the schools pretty often. And so it really becomes a very collaborative approach rather than just focusing on the individual, which tends to happen a lot in adult psychiatry. I think for child and adolescent psychiatry, what is also really important is being very aware of development and the stages. What you're looking for in a 10-year-old that's presenting with symptoms of maybe anxiety will look very different than what a 16 or a 17-year-old is presenting with. So we need to be familiar with all the developmental stages from toddlerhood to adolescence, and keeping that in mind is also important in child psychiatry.
Yeah, it's a new generation. We're all growing up with phones and electronics in our faces 24/7, so definitely a different time to be aware of.
Absolutely.
Yeah.
Absolutely.
Dr. Bala, anything else you wanted to add to that?
Yeah, no, I would agree with that. I think it's important for us to take everything with an understanding of what context these children or families present to us. So it might be the social context, it might be a developmental context, it might be a trauma-informed context. And as we put all of those pieces together, we are trying to develop a holistic care model for these families and kids, and that's really what we do on a day-to-day basis.
So what are some key factors right now affecting mental health, and especially for younger people today?
Yeah, you know, as young people, we've all been there. We've, all grown up with a fair share of challenges, in understanding what our place is in society, how do we fit in with our friends in school, how do we do well in sports, and so on and so forth. But now you have a new set of hardships or obstacles that have presented. We've just a few years ago, of course, the pandemic and the impacts on pandemic, from social isolation to limited pro-social opportunities for kids in very vulnerable age groups. And we're seeing a lot of the sequelae of that now. As you said earlier, social media and its impact, this constant seeking of validation on social media platforms, and its impact on self-esteem, on body image, have all created significant hardships for our youth.
Yeah.
And we see that on a day-to-day basis. So not only are you struggling with that foundation that I mentioned earlier that we all struggle with as human beings, but now you have all of these new layers that are piling on top of that, which has created several challenges for our youth and families.
Yeah. Dr. Roy, what are some warning signs that a parent should look out for that their child may be struggling?
Yeah, that's a great question. Parents know their kids well, and I tell all the parents that we work with to trust your intuition. If something feels off, ask the questions. So things that they can look out for, again, will look a little bit different depending on the age of the youth. A little kid compared to a teen or adolescent will present differently, but look for things that are deviations from baseline. Are they sleeping a lot more? Are they spending a lot more time alone? Are you noticing that hobbies they used to love, they're not interested anymore? they seem to be more shut down with you. Certainly if you're noticing more objective things like they are cutting themselves or harming themselves, you want to make sure you're asking the questions. I think there was, this ideology that talking about suicide or asking about suicide creates the thought and is dangerous to ask, but we know that that's not true. Asking the question, are you having suicidal thoughts? Are you feeling safe? Are really important. And I think as we sort of enter this age where being more emotionally vulnerable and being more open is starting to become more normal, and our youth do a really great job of being more open and being more vulnerable, knowing that your families are also willing to have that conversation is really important. So parents being vulnerable with their kids as well, depending on their age and appropriateness, of course, having those conversations, asking those tough questions, and then also noticing what is different. Are those red flags there? Are they talking about death? Are they seeming different? Are they not eating as much anymore? Those are going to be some more common symptoms to look out for, but will look different in each individual.
Yeah, that awareness with your child is so important. And obviously these can be heavy topics for parents to bring up and hard conversations sometimes to have with your kids. What advice would either of you give parents who are trying to start these hard conversations with their kids and how to navigate that?
Yeah, no, absolutely. These are such difficult conversations, and when you see your child in distress or pain of any sorts, that is going to have a significant emotional toll on the family, right? We want what's best for our kids. It takes a village to raise a child, and I would say it is important for parents to first, regroup, think about how best we can serve, our child in front of us, and that involves listening. A lot of the times, especially adolescents, they might close up or be unwilling to speak or talk about their emotions when they feel that it's a judgmental space where their feelings will be discounted or disregarded. And it is important for the adults to remember to create a non-judgmental space for them, an open space where discussions are welcome, and that they want to strive for a collaborative solution-seeking approach as opposed to, blaming and revisiting some negative events that might have occurred in the past. It is important to get into the child or the adolescent's world to understand them better, and there is an importance for openness on the parents and the family's part to be welcomed into that world. And I would also say, for families to ask for help, right? Go to the school counselor, the pediatrician, or the social worker, or if you have a mental health professional, seek advice. And I think early intervention is something that we would absolutely recommend in these situations.
Right. No, definitely. And like you said, keeping tabs on your kids, listening to them, and knowing who they're friends with and what they're doing. It's so important.
Yeah, I agree.
Well, if a parent or caregiver decides to seek help from CMU Health, take us through that process, what that looks like for parents and what they can expect.
Yeah, so CMU offers inpatient services and also outpatient services. So depending on the need that the child has, that's going to look different depending on which service you are seeking out. For those that are not in a crisis, our outpatient team at our location at Hallmark in Saginaw offers new patients. They're accepting new patients. We take all insurances. There's some wonderful folks out there, and it really just starts with conversations. Once the referral is placed and an appointment is made, you meet with the psychiatrist. Typically they like to see the kids and families together, but also separate to get all those different perspectives. And once they do that, they will come up with their treatment plan, diagnoses, and they will work with the family and the kid moving forward. Medications may or may not be a part of that discussion as well, if that's what the family and treatment team decide is needed. For those that are in more of a crisis and seeking inpatient services, we predominantly work at HealthSource, and the referral process for that is quite different than outpatient. Usually you're going to be going through the emergency room if you will then get placed at HealthSource, but if they come to us, our approach will be similar to your outpatient team, where we're going to work with the child and the family, both individually but also together, making sure that we're getting the goals of both parents and individuals, stabilizing that crisis, and then getting them back home.
And just remind us one more time where CMU Health is located, and once again how people can reach out if they're looking to set up an appointment.
The phone number for our clinic is on the WNEM website. Our website is there as well. You can email, you can call to make that appointment or to get the referral sent to. And like I said, we're accepting all new patients. HealthSource is going to go through the emergency room, so there's no direct line to admission for HealthSource. And we're here to help.
Oh, we love to hear that. Thank you both so much for being here and giving us more information. We appreciate it.
Thank you for having us.
Of course. And as Nikita mentioned, you can find more information on our website. Just go to the hot link section of WNEM.com.